Hi. Welcome back to MedBook. Today let's discuss some more new pattern questions of DHA pharmacist exam. First question is: which of the following antibiotics is considered safe to use in neonates? Options given are: A. Chloramphenicol, B. Sulfamethoxazole and trimethoprim, C. Tetracycline, D. Penicillin G. Chloramphenicol and sulfonamides can cause toxic effects in newborns, due to poorly developed renal and hepatic elimination processes. Tetracycline can have effects on bone growth and development, and should be avoided in newborns and young children. Penicillin G is safe and effective in children. So, the answer is option D, penicillin G. Second question is: salicylate toxicity involves which of the following condition? Option A, serum levels above 300 ug/ml. Option B, metabolic acidosis. Option C, respiratory alkalosis. Option D, all of the above. Salicylate toxicity can occur due to overdosing on salicylates such as aspirin. Salicylates are acidic compounds that can cause metabolic acidosis by increasing the production of lactic acid and acetoacetic acid, leading to a decreased pH. In addition, salicylates can stimulate the respiratory center in the brainstem, leading to hyperventilation and respiratory alkalosis. The toxic serum level for salicylates is generally considered to be above 300 Ug per milliliter. Symptoms of salicylate toxicity may include tinnitus, dizziness, confusion, nausea, vomiting, and hyperventilation. So, the answer is option D, all the above. Next question is: a patient with diverticular disease is instructed to take a laxative. The pharmacist should appropriately recommend: option A, Ispargula. Option B, Bisacodyl. Option C, glycerol suppositories. Option D, magnesium hydroxide. For patients with diverticular disease, it is recommended to use bulk-forming laxatives, such as Ispargula, which can help soften stools and reduce pressure on the colon. So, here the answer is option A, Ispargula. Fourth question: a 61-year-old retired person receiving 10 mg atorvastatin daily may report. Options given are: myalgia, drowsiness, palpitations, and constipation. Atorvastatin is a medication used to lower cholesterol levels and can cause muscle pain or weakness as a potential side effect. Myalgia is a common symptom that some people may experience while taking atorvastatin. Here the answer is option A, myalgia. Next question: a patient is prescribed itraconazole. Which drug may interact with itraconazole? Option A, ibuprofen. Option B, digoxin. Option C, coamoxiclav. Option D, enalapril. Itraconazole is an antifungal medication that can inhibit the metabolism of digoxin in the liver, leading to an increase in the serum levels of digoxin. This can potentially cause an overdose of digoxin and increase the risk of side effects such as irregular heartbeats, nausea, and vomiting. The answer is option B, digoxin. Next question is: the dose of diazepam for children in febrile convulsions is 250 microgram per kilogram. What is the appropriate dose for a child weighing 25 kilograms? Option A, 6,250 milligrams. Option B, 6.25 milligrams. Option C, 62.5 milligrams. Option D, 10 milligrams. Check out how to solve this question. Next question: which of the following vaccines is required to be stored in a freezer? Options are: A. Hepatitis A vaccine, B. Human papilloma virus vaccine, C. Influenza vaccine, and D. Herpes zoster vaccine. Hepatitis A vaccine and human papilloma virus vaccine are both stored in a refrigerator, at temperatures between 2 degrees Celsius and 8 degrees Celsius. Influenza vaccines are also stored in a refrigerator, but they do not require freezing. The vaccine that is required to be stored in a freezer is the herpes zoster vaccine. So, the answer is option D. Next question. A mother comes to the pharmacy with her 3-year-old son who suffers from allergic rhinitis. Which of the following is an appropriate product to be recommended to counteract the rhinorrhea? Options given are A. Budesonide nasal spray, B. Mupirocin nasal ointment, C. Sodium chloride spray, D. Xylometazoline nasal drops. To counteract rhinorrhea or runny nose, caused by allergic rhinitis in a 3-year-old child, an appropriate product to recommend would be a sodium chloride spray. Sodium chloride nasal spray works by moisturizing the nasal passages and thinning out the mucus, making it easier to clear from the nose. It is a safe and effective option for children with allergic rhinitis, as it does not contain any active medication, and does not cause rebound congestion, which can occur with over-the-counter nasal decongestants. Here the answer is option C, sodium chloride spray. Ninth question. A patient is administered 500 ml normal saline over 4 hours using 10 drops per milliliter infusion set. The infusion rate in drops per minute is option A, 2. Option B, 5. Option C, 13. Option D, 21. Check out how to solve this question. Here, the answer is option D, 21. 10th question. A 1% weight by volume solution of a local anesthetic contains. Options are A. 1 mg in 100 ml, B. 1 grams in 100 ml, C. 10 mg in 1 ml, D. 1 grams in 1 ml. A 1% weight by volume solution means that there is 1 gram of the active ingredient dissolved in 100 ml of solution. So the answer is option B, 1 gram in 100 ml. If you have any questions or doubts, please comment below. Subscribe and follow MedBook for future updates. Thank you for staying with us.